Hello, everyone. This is Dr. Clark from the Center for Weight Loss Success. And on this podcast of Doc Weight Loss, we're going to be talking to Wendy Cinta, Dr. Wendy Cinta, who is somewhat of an expert on childhood obesity. Stay tuned. We'll be right back. Welcome back, everyone. This is Dr. Clark from the Center for Weight Loss Success. And again, we're going to be talking to a great friend of mine, Dr. Wendy Cinta. She's up in the New York area, and we're going to get a little bit more comments about that. But also, she is an expert on obesity in the pediatric population. So we're going to shift gears in some of our normal talks today, or what we usually do, and talk a little bit about childhood obesity and maybe what we can do. And she also has a book out concerning this, and you'll hear more about that. Wendy, thank you for participating, and let's say hello, Doctor.
Hello, guys. Thanks for having me, Tom.
All right, so you're up in New York, and obviously we both do weight loss, okay? But you kind of I expand into the surgical side. You expand also in the medical side with the adolescents and children. Tell us a little bit about how this all came about.
So, I'm a family practitioner, so we take care of the womb to the tomb, right? And I really wanted to make sure that the expertise I was giving my adult patients filtered into their families. Everybody who has a problem with obesity knows somebody or knows a child who has an issue with obesity. So it's so important to be able to make sure you take care of the whole family. As I dug deeper, I realized that there wasn't a lot of information on how to treat obese children out there at all. And so I decided to take the research that is out there and kind of put it together in a program, and I developed my own program, which is Bounce, which I'm sure we'll be talking about later on today. But that's how it started from my adult practice.
All right, and just for interest's sake, because I find this incredibly interesting, your background isn't initially in medicine, right?
Yeah.
You did other things as part of your training and education.
I've been in school forever. I started out as an engineer, electrical and computer engineer, and then got a master's in biomedical engineering at University of Rochester. My engineering degree's from Clarkson. And as I was doing my biomedical engineering master's, I realized that I really wanted to be not just part of the technology, but part of the treatment of the people I was studying. And so I applied to medical school, gratefully got into Syracuse, and have now sort of circled back. I did my master's. I did my internship at Duke University, and Duke happens to be a place that has a huge interest in weight loss. They have the Center for Weight Loss. It used to be called the Rice Clinic there. And my first year, I did a rotation through there and thought, here we are treating diseases for family practice with different types of medications and things like that, and we're not really dealing with the true problem. So that's when I got interested in obesity in the first place. The technology is now circled back, and I'm actually doing some stuff with software as well. But I think you got to use every possible thing that you have in your bag of tricks in order to take care of this huge problem.
Right. As you say, this is a complex problem, literally starting from early childhood and extending on to adulthood, to old age. But we've heard a lot recently, kind of in the media, some mixed reviews, because just a couple of months ago, there were some stats thrown out there that, hey, we're getting a better control on obesity.
Right.
Now, how are we really doing?
We are stuck. I think that's the best way to put it. So we started out in the early 70s with minimal obesity rates, in the single digits. And from the 70s on to now, we have grown rapidly to a point where we now have 1 in 3 children with a weight problem and 2/3 of adults, as you know. So at this point in the childhood obesity world, we really are very much stuck, going up in some areas, certainly making no big progress. The recent report that you heard about us, as far as the NHANES data showing that there was improvement in preschool kids, was really a play with numbers. If you grab the right data points, you can get anything to look good. But if you trend it over time, you realize we're still at that 17 to 18% of children with obesity. It's gone up a little, it's gone down a little, but regardless, we're still, we're not making any huge changes, unfortunately, to those numbers, and the numbers are too high.
Yeah, absolutely. And as I'm sure as you know, obese children tend to turn into obese adults. But like you said, 30 plus years ago, in the 70s, it really wasn't like that. So kind of what are some of the causes that are going on here? Kind of why has there been this shift?
It really, there's so many pieces to the puzzle, but I think if we were to narrow it down to one specific thing, it's been a shift in the food. So it's almost like we've done an experiment on ourselves here in America where we said, okay, let's see what happens if we start to turn the food into something that we manufacture and process in not such a natural way. And let's see how it affects us in our health. And I think that, as we've gone from low fat to high, as we did low fat, we went into the higher carb, higher sugar world. And when we started to do that, the obesity rates took off like mad. At the same time, we started to have issues with processed food. The shelves in the supermarket, in the center of the supermarket, got so much bigger. I remember when I used to shop with my grandpa, there were like 6 aisles in the grocery store. And when it started to expand, he said, I don't know what to do with all this. Why are there so many aisles? It takes me forever to get through. And it's because we started to produce so much, processed foods and things like that, food-like substances. And it is this more than anything that has affected childhood obesity and adult obesity, truthfully. We can also say that people are moving less. Certainly there's an issue with technology making a difference. But I have to tell you, most of the kids that I take care of are active. They just eat the wrong kinds of things.
Right. I keep trying to encourage my kids to be even more active in that. But overall, kids are generally pretty active. So it's hard for me to believe that truly is kind of the reason. Obviously, it's very multifactorial.
Right.
Now, some of this also goes back to is kind of the family unit, and how the family impacts kind of this tremendously as well, right?
I don't think it can be overemphasized how important the disruption of family mealtime has affected obesity. The families of today in America sit down to dinner once a week on average. And that is just so sad. That is the time that we used to prepare our meals, gather together, learn about the day. And it has profoundly affected childhood obesity rates. We are eating on the go. We're eating in our car. We're eating, at McDonald's in between sports. We're not really taking the time to treat dinner and treat meals the way that they should be, with the respect they deserve. And if the family's not eating healthy, there's no chance that child will be able to overcome an obesity issue.
Right. And that's kind of one of the, I've always looked at the family as a huge part of treating kind of childhood obesity. And as from my specialty at all, I didn't have the wherewithal in the background to actually kind of treat the whole family. And it was a kind of a conscious choice I made in my profession. I'm sure glad someone out there really is addressing these type of problems. But as you kind of alluded to on this, when you were mentioning kind of the family unit, that it's really changed kind of eating patterns. We talk about, what's a healthy eating pattern or what's not. But when we change the family and with the kids, the patterns have gone way out of whack.
Absolutely. So what happens is the kids are oftentimes running out the door. They tend to skip breakfast. They tend to, I think we've all seen them, the kids that are on the street corner getting a bag of chips and a juice, especially in some of the inner cities, on their way in the door. So if they do eat breakfast, it oftentimes is something horrible for them. And then skipping meals throughout the day, binging at nighttime, again, not sitting down for regular meals, eating a lot of processed foods, not enough fruits and vegetables, not enough protein, and all of that has led to the crisis that we're in.
Absolutely. And you kind of alluded to this, and I'm going to bring us into this topic because the sodas, the sugar beverages, the sugar sweetened beverages, what should we be drinking, especially as kids?
So kids should drink 2 things, and that is water and low-fat milk. And the guidelines that we have from the American Association of Pediatrics say 2 glasses a day of low-fat milk ought to be enough to help with calcium and vitamin D requirements. We do need fat for the children up until the time that they're between 1 and 2 years old. If the child's already struggling with an obesity issue between 1 and 2, which can happen, then you really should go low-fat earlier. 1% or 2% is okay, even if they're at that age. But other than that, it should be water. And unfortunately, that's not what's happening. We actually have the 3rd source of calories for children now is soda. And it goes right to the fat cell, as you know, and does nothing good for that child.
Absolutely. So I hear this all the time. What about fruit juices? Fruit's good for you, right? These fruit juices.
So the only fruit juice that I think is good for you is something like if you're squeezing it yourself, like that has the pulp and the pith and all that good stuff in it. If you're drinking fruit juice, even if it says 100% fruit juice and it's coming from the store, chances are it's just like eating a bag of sugar, and that it's just the sugary part of the fruit, not the fiber, not the healthy ingredients that you need.
All right. I absolutely agree with that. So now, kind of talk some broad topics there, but you've got a specific, you've written a book, which is always a good thing. And tell us a little bit about kind of what's the book and what's in it and how can it be helpful. Just give us a little overview.
Sure. Okay. So my book is called Bounce, and here's what it looks like. I don't know if you can see it there, but I wrote it initially to help parents with their overweight and obese children. And the reason is I just feel like the parents that were coming into my clinic, and they were coming from states outside of my own, were just so lost at trying to find a solution on how to eat healthy. A lot of times they try to go to their primary care physician. They didn't get the answers that they were looking for. Sometimes they would be ostracized for having children with a weight issue, or condemned and told that you're a terrible parent for this. And they really were trying. There's a lot of misinformation that's out there in the press. A lot of misinformation that they get from friends and things like that. So I thought, why don't I take everything that's out there that we know is real and put it together and lay it out for these parents. It's got no bias whatsoever, no political motives, and combine it with the experience I've had in working with children, and come up with a program that's going to that they can implement at home. And in addition, give them something that they can go to their doctors with to sort of ask for the right type of testing. So, because one of the things that I found has happened is children aren't getting tested for some of these diseases that they should be getting tested for: prediabetes, diabetes, liver disease, things that are related to the weight. So I wanted to make sure all of that information was in there as well. So it's basically a handbook for parents to help them navigate through the obesity shark-infested waters.
Absolutely, shark-infested waters. Now, Bounce, that's an interesting name for a book. Where did you come up with that?
So Bounce actually stands for something. It's an acronym, and it's part of the 5 pieces of the program that I created. So the B stands for behavioral modification, and this includes taking care of behaviors of the children and behaviors of the family, both. Both are necessary for success. O stands for optimizing metabolism. One thing we know in adults and children is if you eat 5 times a day and you have protein in each of the meals, you are going to have the best bang for your buck as far as metabolism and energy goes. So we do that in our program. U is united as a family, and what that means is some of the stuff that you were talking about, and that is if you are working as a family, everybody's got to make the changes. You cannot have even one person out there eating chips in the corner if you have a skinny, little brother or dad who refuses to comply, which sometimes is the case. Not just dad, but it can be mom too. But what happens is it really has to be the whole family making the changes. That child needs to not have access to the bad stuff, or he or she will migrate to it. N is for notation of food, and we don't strictly look at calories for children, but what we do is we try to make them understand what they're eating and also understand the quality of the food that they're eating. So we really go into, what is this that you're eating? What are the ingredients? Oh my God, it has 50 different things in it. What is that stuff? What does it mean? How much protein? How much fat? How much of that stuff is actually good for you? And how can we make it better? The C is for counting steps. So even though we mentioned that the children are very active that I take care of, we still give them a pedometer because kids are competitive and we love to be able to start, a competition in the family of how many steps everybody can get up to. And then E is an elimination diet, and that's probably the heart and soul of the book, which is how do you take the foods that kids are eating and start to slowly and covertly take out the bad stuff and put in the good stuff. And if you do it the right way, you get them eating in a healthy way, lots of fruits and vegetables, lots of protein, and they don't even know it's been done. That's the best part of doing an elimination diet.
Right, and that's kind of in the book. You kind of walk people through kind of how to do this. It's not just saying here, here it is. It's kind of walking people through how to actually accomplish these things.
Right. It has to be step by step. You don't want it to be overwhelming. You want to make sure that you can take 1 week at a time. It's a 5-week process, but if you want to hang out at the first week of the elimination diet, which is where we eliminate all the sugar sweetened beverages, then you can do that first if that's a problem. Wait a couple weeks and then advance to the next week where we start upping protein.
Right. Sometimes making monster changes is really difficult. Sometimes stepwise may be the best way to go.
I think so. I think you have to really, be very, very careful with children to make it a fun process, to not be the food police. You want to get them involved in the process, help them, take them grocery shopping with you, get them in the kitchen and have them help you cooking so that they understand what these foods are and things like that. A lot of times they really can get engaged and can start to enjoy the whole process of eating, which used to be such a fun and exciting family tradition.
Right. We'd like to bring that all back. So if I'm trying to find this book, our listeners out there finding this book, how do they get it?
So it's actually available both in print and in electronic versions wherever electronic and printed books are sold. But all of these are available on my website at drwendydiet.com. So if you go to the website, you can learn a little bit more about the practice and what we do. We have success stories on there, and all different forms of the book, including Kindle, Nook, and iPod versions, as well as the print version, are available there.
All right, so that's drwendysdiet.com?
Yeah, drwendydiet.com. No S.
No S. Okay. Dr. Wendy Diet, and it's DR, Doctor?
Yep, DR, Wendy, WendyDiet.com.
All right. I think I got it finally.
It's long. All the other ones were taken.
And all the other ones were taken, right? Sometimes we do that, don't we?
Yeah.
All right. So kind of winding this down, Dr. Cinta, if you were to give us kind of the high points, or if I were going to do, a couple of things, where would you kind of start? What are your best tips of information?
Okay. So I think the first thing is everybody in the family needs to eat breakfast. That's probably where the biggest issue comes, both in terms of children and adults. And if children don't have breakfast, it makes it really hard for them to focus during the day and to, achieve the things they need to achieve. So that's huge. And as you know, it also helps drive metabolism and helps set the stage for healthy eating for the rest of the day. So that's one. Number two is, as we talked about, just really drinking the right kinds of fluids. A lot of times our kids will go work out a little bit and then they wash down like a 200-calorie energy drink. And really all you need is water to help you when you're working out to replenish your fluids. So drinking the right fluids, water and low-fat milk are probably one of the most important things. And I think the third thing is, anything that has more than 3 ingredients on a label is something that you should probably try to avoid. So really focus as a family on getting the processed stuff out of the house. And I think if you do, you're going to notice some incredible changes in the weights of the entire family.
All right. So now, if people just want more information about you, can they get the same information from that website, Dr. Wendy's Diet, drwendydiet.com?
Yep, there's tons of information on there. There's a media page that shows some of the different things we've done with Steve Harvey and the New York Times and some other endeavors. And this podcast will be able to add to it too. And also just some really neat success stories. I think it's hard sometimes when you're looking at your child and you think, how am I ever going to get control of this? But if you can look and see that it's been done by other children, you can see the before and after picture, and look at their faces of those pictures, because they're just so happy on the after pages, and they just have this confidence and flow that they didn't have before. So if they can do it, you can certainly do it with your own child. It should give you some a reason to go for it. It's very, very fixable.
All right. Very good. Well, Dr. Cinta, thank you very much. We're going to wind this podcast down there. If you want more information, it's that website is drwendydiet.com. And if you want more information from me, you can get that through our corporate website, which is cfwls.com, as well as Losing Weight USA. Losing Weight USA is a weekly webinar series with tips and recipes that go out to you. But sign up at www.losingweightUSA.com. So thank you all for listening. We're going to sign off now. Remember, it's your life. Make it a healthy one. Take care, everyone. We'll see you, talk to you on the next podcast.